of the Blatman Health and Wellness Center, and I'm here today with
Dr. David Ellison. I'm the Medical Director and Chief Scientific Officer for Region Medical Centers, Westchester, Ohio.
And what a pleasure for us to be here today. What we're here for is to bring you answers to medical questions. Medicine mystifies many people. How often do you go to a doctor, your knee still moves, and you've been told it's bone on bone and it needs to be replaced, and you have no alternative? How often do you have so many other things in medicine that you're just taught this is the way, and you don't even think, is there another way, but you don't like what you're hearing.
Sure.
You don't like what you're hearing at all, and you're wondering, is there another way?
Yeah, nowadays with the introduction of the internet, the information highway, there's so much information out there, but that information can be more confusing and bring up more questions than it does answer for patients.
And how do you distill what's good information from not so good information? Everybody goes to WebMD, everybody goes to the major health centers, but the major health centers all have a point of view that they want to convey. And it's not necessarily the best of alternative and the best of healing medicine, is it?
Well, medicine can be inherently biased. So if you go to a center that sells whatever it is that they sell or they specialize in, they're going to have a bias, not right or wrong, but they're going to have a bias in promoting that service. They may not educate you on the entire landscape of what all the options are, the risk-benefit of everything is. So that is a problem in medicine for sure.
So if we can help people get answers to these questions, and if we can help people demystify what is so mysterious, even the names of what we have been taught to call things in the language that we've learned, if we can help people do that, then people can make better decisions for their own health care.
Yeah, absolutely. And that's what I see my job as. That's my purpose, is to educate. So when someone comes in, the primary, all of us as physicians really should approach it that way. Our primary objective is to give people an informed decision, which means they have to know all their options, they have to know the risk associated with all those options, they have to know all the benefits associated so they can make an informed decision.
And what does it take for you to be able to deliver that level of information? Because that level of information doesn't come from the traditional medical education. That's a very narrow focus. In order to get the education that you and I are talking about in this, how far have you had to go? How wide have you had to go?
Well, it takes a broad background, so you have to know not just something about everything, you have to know a good deal about what all the options are. So for me personally, I have a dual background, so I'm board certified in internal medicine. I had a long academic career and I taught, but I specialize, my passion and purpose is in regenerative medicine. That's what both of us do. So regenerative medicine focuses on health prevention. So we don't necessarily just focus on disease, we focus on preventing disease. And where disease is present, we focus on curing it. So a little different model of medicine. So for me, in my dual background, it really helps to have that academic, the internal medicine, and my regenerative and nutritional education so that I can...
and we also go back and look for the root cause of the problem. Not just putting a Band-Aid on the issue, but how do you find out where is the root of this cause and how do you get the body to heal around that? So this education, we've had to go far and wide.
Right.
We read a lot. I spent hours every week reading and catching up and moving ahead and getting abreast of the latest information, because the technology that we're using and have been using since the start of our careers to stay on the cutting edge in medicine takes a tremendous amount of effort.
Yeah, it doesn't change monthly or even weekly. Medicine changes every day.
Every day. And
we
every
have to
day
stay
I
on
wake
top of
up,
it every single
there's
day.
something new.
Right.
So what we hope to bring you is answers to your questions. We hope to be able to demystify medicine. We hope to be able to bring you an education that helps you make a better choice about your health care. In our next visit, our next episode, we're going to talk about how to demystify pain. My name is Hal Blatman, Blatman Health and Wellness Center, and
Dr. David Ellison, Region Medical Centers.
You have a wonderful day.
Thank you.